Welcome everyone to our weekly COVID-19 Q&A with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining me again today.
Yes, absolutely. Thanks for having me.
My pleasure. My name is Dilshad Burman. I'm a writer and reporter for CityNews and CityNews 680, and I'm going to be moderating this chat today. Now, the way it goes is we've been collecting your questions over the past few days for the doctor. She's never seen them before. We're going to ask them to her today, and she's going to answer them off the cuff. If you haven't had a chance to submit your questions, you can still do so in the live broadcast, in the live chat, and we'll try to get to as many as we can in this short 30-minute period that we have with the doctor. So how it's going to go today is we're starting off with the questions that we've collected over the past couple of weeks. We actually have quite a big backlog because we had a flood of questions coming after the holidays. So we're starting with testing questions again. We had a few left over from last week. We're going to move on to vaccine questions and then the other generic questions that we have. Anything else you want to ask, you can jump right into the chat and we'll try and take it live. So for now, Doctor, are you ready to go? We're going to start with the testing questions. Okay, let's go. Let's start with Mark. Mark asks, why doesn't the government allow grocery stores to sell PCR tests? Other countries are doing so, and the PCRs are cheaper and more accessible to everyone that way.
Yeah, I guess that's a good question. In terms of trying to make testing more accessible, right now for those who are eligible for testing, it is free. And I think that is part of our public healthcare system.
Right.
And so we're starting to see now a bit more availability of rapid antigen tests. And so each student in school is going to have access to them. I think, those pharmacies, those grocery stores that have a pharmacy would be able to do those tests. Mm-hmm. The PCR tests actually require you to send it to a lab. So it's not just like you can purchase it there. You have to be able to have a mechanism for you to be able to submit it, right, for it to get sent to the lab. Yeah.
Right. And then again, if the labs are backed up, you're still not going to get it any sooner than you would if you were eligible and took an actual test at a hospital or wherever, right?
That's right. Yeah.
Exactly. Okay. RT says, I am an essential caregiver and my kids are back in school. How will I know if it's safe to go to work without knowing what's happening in my children's classes? The rapid antigen tests don't catch the virus early enough, and I could bring it home from work.
Okay, so another good question. So we've actually moved into this place in the pandemic where there is so much more COVID, it spreads so much more easily that we're now relying on symptoms to determine if someone has COVID. So we're certainly not recommending that everyone get a test every day. We're not doing screening rapid antigen tests. Students should have, I alluded to this, come home with 2 tests. And so if they have symptoms, you can use it at that point. If you have symptoms because of where you work, you can see if your work can provide you with testing, or if you work in one of those workplaces where you're eligible for testing to get tested. But I think what it speaks to is that's why we still have to wear a mask, keep a distance, stay home when we're sick, in order to prevent any additional spread. And certainly those measures in schools are going to help to prevent the spread in schools.
Right. Okay. And then this is anonymous. Can you explain how cycle thresholds work? What are the current cycle settings? And what have they been during the pandemic? Why is this not public information?
Okay, so I think we've had this question before. The cycle threshold is a very specific lab based cutoff. And so each lab has to come up with their own cutoff. The cutoffs range between 30, 35, sometimes a little bit higher, depending upon the lab. And so for those who don't know what it is a way of telling if you have a positive PCR test, is the result likely to be from a new infection or from an old infection?
Okay, and the higher the cycle threshold, the further back it can tell. I feel like that's what we talked about.
That's right. So the lower the number, the more likely it is that your infection is from a recent infection.
Right. Okay. All right. Let's take Wing's question. Wings asks, when should the rapid antigen test be used since they are in short supply, and how reliable is it?
Okay, so I would recommend using it when you have symptoms and to save it for those times. If you have even one symptom of COVID, one of the major symptoms or 2 of the minor symptoms, you can take the test. And the tests are actually a way to actually rule out COVID in certain circumstances. So for example, in schools, If someone at home has symptoms, in order to get the kid back to school, the person who has symptoms, do one test, wait 24 hours, and do a second test. And as long as the symptoms are getting better, the 2 rapid antigen tests are negative, then you're cleared from the infection. So really, we're saying 1 positive is a positive. You can stop there, treat it like it's COVID. 2 negatives, 24 to 48 hours apart, are required to clear. And it's not clearance testing. So it's not, if you test positive, you need to then keep testing until you get a negative. That's not it. It's only if you have symptoms and you're not sure if it's COVID. If you do a test and it's negative, well, you're going to have to repeat another test to make sure that that's negative. And then you can say, okay, I have symptoms, but it's not COVID.
Okay, okay. And doctor, we had heard, I saw sort of this contention going around online that the rapid antigen test, you do sort of an outer nasal swab. And then some people were saying that, you know, actually to catch Omicron, you have to do a throat swab for the rapid antigen test. Is that something that's recommended?
You should really follow what the manufacturer says. So each of the rapid antigen tests has different ways to collect the swabs. Some are outer nasal, some are more deep nasal, for example. The thing about using the throat swab is sometimes, you know, if you have juice, for example, in your mouth, depending upon what you eat, that can actually influence the results. And so that's why I would really recommend that you follow the instructions on the kit.
Okay, okay. And then Jen asks, I feel like we just touched upon this, but let's ask Jen's question. If I tested positive with symptoms on January 3rd on a rapid test and it was positive again on January 15th, when will I know that I am clear and not at a risk of shedding the virus?
Yeah, it's a good question. And it kind of goes back to that psychothreshold question that sometimes you can continue to be positive. It doesn't always mean that you're still contagious. And so that's why it would be, you know, if you had symptoms on the 5th and you're vaccinated, by the 10th or 11th, if your symptoms are improving, then you don't need to test again. As long as they're improving and you're vaccinated, you're cleared from isolation. I would only recommend that you get retested if now, you know, a week, 2 weeks, 3 weeks later, you have new symptoms and it could be a new infection.
Right. Okay. And that's all we have for testing questions right now. If you have any more, please jump in and we'll take them live. Actually, speaking of live, let's take this one about vaccinations because we're moving into vaccine questions. I don't know who sent this in, so I'll say anonymous. It says, I had my booster on December 18th, and I understand that I'm eligible 84 days after that date to get a second booster, which is a 4th vaccination. Am I eligible? And if so, when am I able to book online? We don't have an age for this person.
Okay, so the only people that are eligible for a 4th dose are those who are moderately to severely immunocompromised, or those who live in a long-term care home, a congregate senior setting. And the reason for that was they actually got their 3rd dose early on. In fact, many who are immunocompromised, we talk about them needing 3 doses to start, whereas most of us need 2 doses to start, they need 3 doses to start, in which case that 4th dose is actually their booster dose. Right. So it only applies to those specific groups.
Okay. And then, okay, the next, we'll go to our submitted questions here. Mama Moose asks, what data supports shortened 5-day isolation in unvaccinated people with symptomatic COVID-19? If the median infectious period is 10 days, how will schools remain open with a shortened 5-day isolation that allows students to return while they're probably still contagious?
Okay, so it's only 11 years and younger who are, regardless of vaccination status, who can return after 5 days. Okay. This is provincial policy that has done this. We know that children tend to have milder symptoms in general, especially younger children of COVID. And generally, when you have less symptoms, generally you are less contagious compared to someone who is, you know, sick in hospital, for example. While they are very sick, they are likely still contagious.
Okay. Okay. And so, sorry, doctor, you mentioned that the 5-day isolation and return to school is only for the kids who are 5 to 11. Kids who are 11 and up have to stay home for 10 days?
Kids who are 12 and up and unvaccinated have to stay home for 10 days, yeah.
Unvaccinated. Okay, got it. And then a secondary question from Mama Moose. In your opinion, is the 5-day isolation period appropriate or safe for elementary school settings and childcare settings?
I think there is science behind the 5-day period. Remember, when a child is going back on day 6 or 7 or 8, they can only go back if their symptoms are improving. They can't have a fever anymore. So it's not just 5 days. For some kids, if they continue to have symptoms, their isolation period will be longer than that. Mm-hmm. And also, they're going back to school where there are those other layers that are going to help prevent the spread, right? Wearing the mask, staying in the cohort, being outdoors, having HEPA filters or ventilation, that kind of thing.
Okay. And then let's move on to Wall's question. Wall asks, why does it take so many doses of the vaccine to gain immunity? Why should we be putting more vaccines in our bodies when the previous doses have had no effect?
Okay, so actually we know that 2 doses provided most adults, adolescents, very good protection actually. But what we found, and you find this with the vaccines, is that you get waning immunity following vaccination. Sometimes that's okay. Even though you can't find, antibodies in your blood, they're less than when you were first vaccinated. If you are infected, your body will produce the antibodies and give you that protection. With Omicron, by the time that you're infected, sometimes in a couple of days later from when you are actually exposed, you can actually get infected. So it doesn't give your body that much of a time to up its antibodies, to start producing its antibodies. That's one of the more reasons why with Omicron, we need that booster, because we need to have higher circulating antibodies so that if we are infected, it can provide that more immediate protection. Right. So it's not that the first 2 doses did not work. And as well, we know that the first 2 doses are still, for the most part, keeping health people out of hospitals from getting very sick with the vaccine, even if you haven't gotten your booster dose.
Right. So, doctor, you just mentioned with Omicron, you can get sick in 2 days. So is the incubation period shorter than it was for like the original COVID and Delta?
That's right. So it tends to be a shorter incubation period. So from the time that you're exposed to someone, you tend to develop symptoms sooner.
Okay. So it used to be 14 days earlier, right? Like you had to wait 14 days after exposure to see if you actually got COVID. Now it's much shorter.
Now, so we still say, about 10 days or so from when you're exposed to when you can develop symptoms, but most people are developing symptoms in the early half.
Right. Okay. Okay, let's take some live questions here. Ree asks, if Canada requires a negative PCR test to come back from abroad, what happens if you have had COVID previously, but have since recovered and the PCR continues to come up positive? Should Canada look at changing this to a rapid test?
Okay, so I think you're going to have to check first the regulations from the airline and then the country, because I think some places have, if you have a previous positive more than 2 weeks ago, then it's okay. So there are some, but again, the country may have something different, but the airline might have something different as well. So you're going to really have to do your homework if you're planning to travel abroad.
Yeah, this is with reference to returning to Canada, though, because Canada requires a negative PCR test as well to come home, I believe.
Yeah, I think it's worth double checking that, because I think there might be, if you've had a positive that you can document from a few weeks ago, whether there's some leeway there. I can't answer that definitively, but it's worth checking.
It's a federal policy. Yeah, absolutely. Okay. Let's go to the next question here from Vashti. Vashti asks, is it 2 rapid antigen tests or 2 kits that the children are receiving when they go to school? We talked about this last week as well.
Yeah, my understanding right now is that it's actually 2 tests.
2 tests.
So it's not 2 kits, it's 2 tests. And that's why I would really recommend that parents save those for when the child has symptoms.
Right. Okay, let's take Leslie's question. My son is 15. My son is 15 years old. He got the 2 Pfizer doses back in July of 2021. Because of his age, he can't get the booster shot. What is the risk from him going to school every day? Okay,
so right now there are no recommendations for adolescents to get booster doses. This is something that's being looked at by advisory committees, but has not been recommended in Canada. So again, those 2 doses will protect your son from getting very sick from Omicron. And then it's again about those other things that your child can do while attending high school. You know, the mask, the physical distancing, keeping their social circle, small, socializing outdoors, for example.
Right. Okay, let's move to SB's question. SB asks, if I just had COVID, do I need a booster shot? And if so, how long should I wait before getting it?
So the recommendation is still that if you had COVID, you can get the vaccine. The recommendation right now is that you can be vaccinated as long as you're free from isolation and your symptoms have resolved. And so that's the guideline for right now.
Okay. And then this is actually a Wings question from last week. Like I said, we're still getting through a backlog of questions. If you get the flurona infection, which I think is flu and coronavirus together, do you need a second flu shot in the spring? Although COVID-19 testing is restricted, how would you be able to tell the difference?
Yeah, good question. Now there are some places where the flu virus testing is still being done, like for example in long-term care homes or in hospitalized settings, for example, among very sick patients. We don't generally recommend repeating flu vaccine in the spring, and that's because by the spring usually flu season ends. At least in the northern hemisphere. Now, if you were planning to travel to the southern hemisphere, that might be a different story. Right. But in Canada, we don't recommend, even if you got the flu, to get booster doses of the flu vaccine in the same season for adults.
Okay, so it's a once yearly thing. We're not looking at any extra boosters for flu. Okay. Okay, let's take Cammie's question. I understand one must wait 30 days before receiving the booster after contracting COVID-19. Is that 30 days from the onset of symptoms or 30 days from being symptom-free? And what is the reason for waiting the 30 days?
Okay, so 30 days is a recommendation. You could wait 30 days. Sometimes if you give a bit of spacing between when you had your infection to when you get your booster, the booster will give you that boost in your immunity. But you could get your vaccine as soon as you're out of isolation and your symptoms have resolved.
Right. Okay, Caesar asks, if I had COVID symptoms and tested positive in an antigen test, how long should I wait after recovering to take the booster? Again, the same guidelines, I'm guessing.
Yeah, same guidance, yeah.
Okay. Mark says, I am double vaxxed and tested positive on New Year's Day. We've passed Mark's question. I'm sorry. This was for January 18th. I have my booster scheduled for January 18th. Can I still wait or shall I wait a little? Can I still take it or shall I wait a little longer? So I think this is all with timing. Like you said, as long as you're symptom free, you can take your booster.
That's right. Yeah.
Okay. Anne Marie asks, will under 18 be able to get a third dose sooner rather than later?
So right now it's not recommended for 12 to 17-year-olds or 5 to 11-year-olds. So we're going to have to wait to see what in the future whether there are recommendations for booster doses for the younger kids.
Right. Okay.
Or adolescents as well.
Adolescents, right. Okay. Heather asks, is public health looking at allowing 4-year-olds turning 5 in 2022 to be vaccinated? They're in schools with zero protection.
Yeah, so this is certainly something that has been looked at by the Ontario Immunization Advisory Committee, for example. What you have to recognize is that the vaccine is licensed at 5 years of age. It's not licensed sooner than that. So if you give it earlier than that, it's considered an off-label use. And we know that Pfizer has a vaccine for 2 to 4-year-olds or 6 months to 4-year-olds. And so there may be a different vaccine for 4-year-olds. And so that's a part of the waiting is if there is going to be a vaccine for 4-year-olds, well, why would we give them the vaccine that's not for their age group?
Right. Okay, let's go to Kuljit's question. Kuljit asks, how safe are the booster shots for pregnant women and should I get it? If I got vaccinated before I got pregnant, I got vaccinated before I got pregnant, and now I'm debating on whether I should get the booster shot because pregnant women are not part of the clinical trial for the booster shot. So I'm not sure how safe it is for us.
Yeah, good question. I mean, there have been thousands and thousands of people who are pregnant who have been involved in registries to ensure that the vaccine continues to be safe.
Mhm.
And it is safe in pregnancy. And we know that in pregnancy, you can be at much higher risk for getting very severely sick from COVID. We also know that if you are vaccinated, including getting a booster when you're pregnant, you can actually pass some of those antibodies to your baby. And that will help to protect your baby as well when your baby is born.
Okay, so the recommendation is go ahead and get your booster, even if you got your first two vaccines before you got pregnant. None of that matters.
Well, it matters. Oh, yeah, totally. It's great.
Yeah.
But if you're eligible for a booster dose, I would definitely recommend that you get it.
Right. Okay. Tammy's question. Let's take Tammy. Tammy says, will these shots cause any brain development in our children? Any brain development problems in our children, as this is an experimental vaccine? I cannot find any data on this. And anyone I ask says we cannot 100% guarantee that the children won't be affected.
Yeah, so I mean, the vaccines have been around for adults for over a year now, right? We certainly haven't found any links between the vaccine and brain development, cognition, concentration. What we do know, though, is that a COVID infection can lead to long COVID, and long COVID has been identified as causing concentration problems, that brain fog, and that can also occur in children. And so I think when we're we don't know 100% about anything really, including vaccines, but we do know more about COVID, including what COVID can do, including impacting the brain.
Yeah, absolutely. And doctor, you just mentioned long COVID. I know this question is coming up later on in my list. How are we tracking long COVID, if at all we are tracking it in Ontario?
Yeah, there's no particular surveillance system for long COVID, so we really don't know. There are kind of research studies to be able to try and understand this a bit more in terms of what's the percentage of people who experience long COVID, but there's no particular surveillance system.
Okay. Let's take Lucas's question about booster doses. What assurance can people get by getting the booster shot and not getting COVID, since more and more people in the USA who are boosted are getting COVID, ending up in hospital? In Israel, it's been proven already that the booster is not working because people are already getting the fourth dose. Why is that?
Okay, so we know that the booster dose can certainly help protect you from getting an Omicron infection. It does have some vaccine effectiveness for that. But you can still, as you know, with being vaccinated, get an Omicron infection. Now, it is tending, without doubt, to be a milder infection in those who are vaccinated. And so if you can't look at the total numbers of people in hospital who are vaccinated versus unvaccinated, because a very large proportion of our population is vaccinated. And so you really have to look at the proportion. And so this was one statistic that came out yesterday, that in ICUs, 50% of the patients are unvaccinated, whereas the unvaccinated make up only 10% of our population. And so it just goes to show how much that higher risk is for the severe infection. And that's really what we're trying to prevent with these vaccines.
Right. Okay. And then actually, let's take this live question coming in from Paul. Can I travel within Canada? I want to leave Ontario and go back home to Newfoundland. When is it safe to travel, basically, within Canada?
So Ontario doesn't have any restrictions for within Canada travel. The eastern provinces have had varying restrictions in terms of you have quarantine if you go there or don't, or testing or whatever. So you'll have to double check with Newfoundland what their requirements are. In terms of how safe is it to travel, of course, if you can drive there, that will probably be safer from a COVID perspective. Because you can keep a physical distance, compared to being on a plane. So I think however you end up traveling there, you're just going to have to take precautions.
Right. And let's do these. Jody and Joanna have a similar question about heart inflammation and myocarditis. Let's see what Jody says. Is there any way we can have our child tested to see if they have had heart inflammation after the vaccines? If this did occur, would it come back? And if they had chest pain after a second dose that is of an unknown cause, is it safe for them to get the booster? I'm assuming this child is above 18.
Yeah, so I think what I would say is really you want to look for symptoms. Like, think about inflammation. If you have inflammation in your fingers will feel very sore. If you have inflammation in your heart will feel very sore, and so you will complain of chest pain, racing heart, trouble breathing sometimes. And so if you have symptoms, absolutely go to the emergency department. They can do tests to check that. I wouldn't let symptoms go undiagnosed, but I also don't recommend that every kid who has a vaccine goes to get tested for this, because even I can tell you in my own experience as an emergency physician, even people who had chest pain following vaccination, when you do all of the tests, there's no sign of inflammation of the heart. I mean, chest pain can be also a lot of other things.
Absolutely, absolutely. Just as a personal anecdote, I have costochondritis. It's an inflammation of the cartilage in your breastplate, and that feels very painful, like myocarditis or a heart attack. So chest pain is a lot of things for sure.
Yes.
It's not fun. I can tell you that. Let's take another question from our website from Ree. What are the chances of getting Omicron if you had the Delta variant previously and have received your booster?
Okay, so I guess the question is, how long ago did you have the Delta variant? I mean, we're finding around the world that people who have had COVID can get and are getting reinfected with Omicron.
Right.
And so a previous COVID infection in the last, say, 90 days might give you more protection. Beyond that, might not give you, it's hard to know how much protection. Of course, that booster you talk about will help to boost that immunity to the infection that you got. But but there's no guarantees that Delta infection that you got is going to really give you that, better protection. I really just don't have data on that.
Right. Okay, let's take Cammie's question. Does the vaccine and following all of the COVID protocols prevent you from contracting COVID, specifically Omicron, or is it just about reducing the severity of symptoms? And is it true that we will all eventually get it? I know of at least 2 people who were triple vaccinated who contracted the virus. One was, of course, a liver transplant patient, but thus far has been managing well enough at home, so they haven't been to hospital.
Oh, well, that's good news to hear. Yeah, and that's really the success of the vaccine, and I'm glad to hear that. Is everyone destined to get Omicron? I'm still on the fence on that. I think really there are still precautions that you can take to prevent Omicron infection. And right now, if we've reached our peak, if we're plateauing, if we're coming down, if the cases of Omicron in the community lessen, then your chances of getting Omicron will go down. Mm-hmm. And with measures like wearing a mask, keeping a distance, staying outside, you can prevent an infection. So the vaccines, the 2 doses may not fully protect you from getting infected, but you might just have a mild illness as well. So yeah.
Yeah, I mean, it's hard to say whether everybody's going to get it or not. I agree that there are a lot of things that we can do to prevent it. I think that recently we've been seeing, and we were talking about this in our news meeting as well, that people are sort of resigned to the fact that everybody's going to get Omicron, but that's not necessarily true.
Exactly. And it's really hard to predict what proportion of the population has gotten Omicron so far, because now we're not doing testing. Not everyone went for testing. Yeah. Is it, 50%, 60%? Is it 30%, 80%? Like, we just don't know that part either. Right. And so that's the other piece as well.
Right.
Sorry, the last piece to add here is we don't know how long Omicron is going to last as our main variant. And that's going to determine as well whether everyone is likely to get it, right? Whereas we had Delta for a long time. Alpha, the wave in the spring, it came and then it went, and then it was replaced by another variant. So that's another important piece of information.
So, doctor, then we're looking at possibly it being replaced by another variant or disappearing, which is also hard to predict.
I guess they're all possibilities, aren't they?
Absolutely. Okay. We got 1 minute, so we're just going to quickly squeeze in this question. BG says, my son turns 12 in 3 weeks, but I can only book him for a pediatric vaccine, which is the 5 to 11 vaccine. So he'll get 1 pediatric dose and then a full dose of the second shot. Is that correct, or is that okay?
That's right. So you'll get the dose based on your current age.
Okay.
And that's okay. Yes,
Yeah.
that's just fine.
Okay. Let me see if I can squeeze in one more. If I had Omicron, is my immune system now stronger against other variants or weaker? And do I still need a booster? This is from Gail.
Yeah, I mean, I don't know about future variants. I don't know how much the protection from Omicron, how good it is, how well it's going to last. I have those same questions. That's why I would still recommend the booster, because we know that the booster, even if you had Omicron, will boost even that immunity to give you stronger immunity.
Right. Okay. And that brings us to 1 o'clock. Wow, lots of questions still left over. We'll try and get to them next week. Thank you to everybody that submitted live and submitted over the past few days as well. Doctor, thank you for your patience and answering all these questions. For now, we'll say thank you and bye-bye. Bye, doctor.
Bye.